Prior to every anesthetic procedure, we always do a physical exam the morning of the procedure. Place an IV catheter in the forelimb. The IV catheter allows us to induce anesthesia, and then once they're under anesthesia, allows us to give IV fluids during the anesthetic procedure, and also allows quick access to the vein in case we need it during the anesthesia. And then after we place the IV catheter in, then we'll give an injection as a pre-medication that allows the anesthesia to be induced more smoothly, and also gives us some preemptive analgesia or preemptive pain management. We're getting ready to induce anesthesia with propofol, and we want to have an endotracheal tube. What an endotracheal tube will allow us to do is it will allow us to administer the gas anesthesia as well as the oxygen. And it's really important to use what's called a cuffed endotracheal tube, where we infiltrate air through the cuff, and it allows the balloon at the very end of the tube to enlarge, and it forms a good seal between the tube and the inside of the trachea. And this will prevent the dog from aspirating any material during the anesthesia. We now have the patient under anesthesia. We have hooked up to EKG, we have hooked up to pulse oximetry, capnography, and respiration and temperature, and we can monitor all that on this screen. And now we're getting ready to start the dental. This is our dental machine. It's the Vet Pro 1000, and it's the latest generation, the newest generation of ultrasonic scaling. There's a hand instrument for the ultrasonic scaling, an irrigation unit, a hand polisher, and then we have a motor drive, and that's used for extractions. And Chelsea is going to use the ultrasonic scaler to remove the tartar. And the ultrasonic scaler is the safest way to remove tartar. It uses ultrasonic activity to break up the tartar with water running over to keep the tooth cool. It's much safer than the hand scaling. When you use a hand scaler, you will actually scratch. There will be microscopic scratches to the enamel of the tooth, and when that happens, then it provides a magnet for tartar and plaque to adhere to. So ultrasonic scaler is the safest and most effective way of cleaning the dog's teeth. Okay, the technician has just cleaned the teeth and now is performing a dental exam. We use a dental probe to check for obvious pockets or obvious signs of abscesses. And she's found one suspicious tooth, and she's going to take a radiograph, a dental radiograph of that tooth. Okay, Chelsea's now positioned the X-ray probe into the dog's mouth, and we're going to take a dental X-ray of it. And here's the X-ray of the tooth. You can see this is the crown of the tooth. This is the part of the tooth that you see, and this is the part that's buried up in the bone. This is the part that we don't see and we're not able to see just from a probe. So dental X-rays are very useful in determining if there's pathology or abscesses deep up into the bone. And this tooth, fortunately, looks good. Okay, now Chelsea is finishing polishing the teeth. Polishing of the teeth is just as important as removal of the tartar. What the polish does is removes any little scratches, tries to create as smooth of a surface as possible on the crown of the tooth or the enamel surface of the tooth. And after the polishing is done, she's now going to rinse the teeth and dry them and prepare for the application of the Oravet. Drying the teeth after they were rinsed, and now she's going to apply the Oravet sealant. What the Oravet sealant does, it provides, it helps fill in little microscopic grooves and any scratches or etching of the teeth, and creates a very slick surface and makes it much more resistant for plaque and tartar to adhere to. The Oravet can also be used at home once a week or once every other week for owners to apply at home to help resist the formation of tartar and plaque. All right, now Chelsea is done with Annie's dental cleaning. Now we're going to disconnect anesthesia and move Annie to post-operative recovery. Anesthesia, or the dental cleaning, is a general anesthetic, but with the newer type of anesthetic drugs that we use, she'll be wide awake here, usually with